Tanya from Created Health, Nutrition and Fitness. I have some science information for you today in regards to exercise. We know that physical inactivity is the fourth leading risk factor for death in the world. We also know that physical inactivity leads to diabetes and hypertension, and it is the best way to help people with rehab also. So for a long time, it has been recommended, both the medical industry and the health and fitness exercise industry have been recommending that people do 10,000 steps per day for their good health. So what these scientists did in Japan, they took that information and applied that information to another form of exercise known as IWT. So the research was conducted for a 5-month duration. They had 246 participants that were middle-aged. When we look at research and we talk middle-aged, that refers to people that are aged between 45 and 65 years of age, and they are considered in research to be middle-aged. So this 5-month duration, they broke the people into 3 groups. They had one group that just did not do any walking whatsoever. Then they had a second group that were doing the recommended 10,000 steps per day. And they then had a third group that was conducting the IWT. So at the end of the 5 months, with the walking group, they were doing the 10,000 steps 4 times a week, and with the IWT group, they were doing that 4 times per week over the 5-month period. So at the end of the 5-month period, they measured the systolic blood pressure, and they found that the people that were in the group that performed the IWT, their systolic blood pressure was 4 times lower than those that were doing the 10,000 steps per 4 times per week. They also found that they measured the diastolic blood pressure, and there was a reduction of 2.5 times greater or lower than those doing the 10,000 than those in the 10,000 step group. So they looked at continuing the research, and they continued the same research for another 5 years. And then at the end of the 5 years, they looked at the stroke risk, and they found that those people that were doing the IWT program had reduced their risk of stroke by 40% in comparison to those that were doing the 10,000 steps. They also looked at depression symptoms, so people that do experience symptoms of depression, and the IWT group had reduced depression symptoms by 50%, which is a really big reduction in depression symptoms. They looked at sleep efficiency, and they found that people in the IWT group had improved their sleep by 12%. And then, of course, there were participants that did some self-reporting themselves. A lot of them said that their mental well-being, they felt better, their mood was better and lighter, which we know is associated with exercise. The participants also said that they felt that there was a improvement in their immune system. So a lot of people reported, and it was self-reporting, that they had less frequency of common colds and flus, and asthmatics self-reported that their management was better for asthma, and the frequency of attacks was also reduced. But like I said, that wasn't monitored, but that was self-reporting from the people who were participating, and those reports were from people in the group doing the IWT. So how do you do IWT to get all of these really, really good health benefits? It is designed, initially it was designed for athletes, and just to break the high intensity exercise that a lot of athletes perform at on a regular basis. So the idea was to give them a different style of exercise. So the IWT was invented for athletes, and it has been now transferred over to everybody and recommended for everybody to do. So it's easy to do. The only equipment you need is really good supportive exercise shoes. So make sure that your runners that you have good grip on them, and that they fit you well, that they're not too tight, not too loose, and wear whatever you're comfortable to exercise in. So that's the equipment that you need. And it's done by 3 lots of 3. So to initiate IWT, just spend a minute or two doing some nice gentle stretches and warming up the body, hamstring stretch, Achilles tendon stretch, quad stretch, calf muscle stretches. So just couple of seconds or a minute, whatever you've got, just to do a little bit of warming up before you commence. And then from there, you're going to do 3 minutes of walking, and you want to walk at a nice gentle pace so that you can breathe and that you're not stressing your body at all. At the end of the 3 minutes of gentle walking, you are then going to do 3 minutes of high intensity walking. So this looks like opening out the shoulders so that you can breathe properly, and swing your arms vigorously. So it's a vigorous swing with the arms. It's increasing your gait, so striding with your step, making sure that your heel is the first thing to land on the ground with each stride. You will find within a minute of doing this, you will start to increase your respiration. You'll start to breathe more heavily, which is the whole idea of this as well. So you're going to do 3 minutes of gentle walking, immediately come into 3 minutes of big, vigorous, wide strides, getting that heart rate up. That is considered 1 set. You are going to do a series of 5 sets, and 5 sets should roughly take you around 30 minutes to achieve. And you're going to do that 4 times a week, and you will start to see improvements. They found that the improvements that were suggested were after a 5-month duration. However, they also, what else did they do? They looked at continuing the study and looking at other parameters in the body to see what else was improved. And so they looked at the strength of hamstrings, and hamstring strength is really important for knee strength and that extension of the leg, so your leg can extend out and in. So they looked at hamstring muscles, and they found that the strength of the hamstring was increased by 12%. They also looked at aerobic fitness, and they looked at peak oxygen uptake, and they found that those doing the IWT had improved by 10% in comparison to those doing the 10,000 steps. So obviously those doing no exercise at all had no health benefits one way or the other. And then those doing the 10,000 steps did not get the same benefits as those doing the IWT. So that was quite interesting how that was how that research was conducted and the benefits that they found. So the idea is to try and get everybody out there and enjoying some exercise, getting some fresh air, getting some sunlight. So I hope you enjoyed this installment. Sometimes I will come to you with science research like I have today. Other times we will talk nutrition, we will talk exercise, we will talk mental well-being. I'm here for all of the conversations, because at the end of the day, your health is your wealth, and we want to have not only longevity of life, but good quality of our longevity of life. So I'm Tanya from Created Health, Nutrition and Fitness. Please subscribe and keep an eye out for more scientific research and health and fitness information.